back. We've got Dr. Jenna Mendelson with LeBauer Behavioral Medicine with us today, talking about the importance of mental health. Let's jump right into it. If someone says it's probably just a case of the blues or maybe being nervous about something, I don't need to talk to someone, something of that magnitude, what would you say?
I would say maybe, but why suffer for longer than you really need to when there's help available? I think many people have a concept of therapy that is maybe very kind of classic and Freudian in nature, that it means that you're going to go lie on a couch and free associate for at least an hour every week for the rest of your life. But that's really not what therapy has to be. There is a wide range of treatment options available, including many shorter term treatments. You may find that you really don't need a lot of sessions to feel an improvement. In fact, there's research showing that the majority of benefit from therapy takes place within the first 6 sessions. So why not? There's very little documented harm, and there could be a lot to gain by talking to somebody.
Sure. What if you are concerned about someone, say an adult? What should you do or not do?
So, this is a tough situation that can really vary based on the specifics of the situation and the individual involved. So, that's my disclaimer. But broadly speaking, it's a good idea to check in with someone if you're concerned about them. And it can be as simple as asking them if they're okay. And letting them know that you're there for them. If a person really doesn't want to give you a lot of detail of what's going on, generally speaking, I recommend respecting their boundary and not overly pushing. But it can be good to go into a conversation like this prepared with some resources that you can give them. So, the name of a provider or one of the agencies that we just talked about could be really good to have ready to give to somebody. And actually, if you happen to be someone who's had an experience of confronting a mental health challenge and maybe getting help for it, it could be a good idea to let the person know. I wouldn't necessarily go into a ton of detail about your experience, but just to let them know that you've dealt with something too. This can have the double benefit of normalizing for them that they're not alone, that other people go through things too. And also they have the benefit of knowing that the person or agency you're recommending is somebody you directly have good experiences with. So they might be more likely to get help that way. And if you're concerned about someone, it might be good even to offer to be there with them to make the phone call. Many neuropsychiatric conditions come with a difficulty initiating tasks as one of the symptoms. So even somebody who's really motivated to seek help might just have a hard time picking up the phone to do it. So you can offer to the person that you're willing to be there with them to make that phone call as a way to help them take that step.
Wonderful. Dr. Mendelson, thank you so much. And if you came in at the last second of this conversation, you can find the entire thing on our website and YouTube page, WFMY News 2.